Welcome to Power Up Recovery with Nutrition. It is time to make nutrition part of the conversation. I'm your host, Christina Veselak, and I'm so glad you're here. Did you know that it's our brain's job to allow us to cope with stress gracefully? But to do that, it needs to be fed optimally. Have you ever wondered why so many committed people relapse or maybe even die? Why so many people on psychotropic medication still feel lousy and still have cravings? What if the missing piece is food, the right food? What if the right nutrients like amino acids or even eating protein every 4 hours could actually balance your brain chemistry and your mood without medication and support lasting recovery? In this podcast, we explore the powerful connection between feeding your brain well, mental health, relapse, and recovery from addiction. We will share insights from experts, inspiring recovery stories, and practical strategies you can use today. Whether you're in recovery, a healthcare professional, or someone passionate about emotional well being, this show is for you. Let's dive in and discover how fueling your body and brain with the right food, the right amino acids, and other key nutrients can fuel your transformation today. Welcome. Welcome to an episode of Power Up Recovery with Nutrition. I'm your host, Christina Veselak, and I am delighted today to welcome Dr. Michael Lewis, who is a national expert on traumatic brain injury and the use of omega-3 fatty acids, specifically fish oil, to decrease the symptoms and help the brain heal. This is an especially important topic for those of us working in the substance use disorder field because both research and clinical experience shows that people with traumatic brain injury have a much harder time succeeding in treatment and preventing relapse. And so we're going to be talking about why that is and what we can do about that nutritionally, and also possibly with some other modifications in treatment. Dr. Lewis, welcome so much.
Thanks, Christina. It's great to be with you. I appreciate the opportunity to talk to your audience.
I'm glad you're here. So, why don't you introduce yourself to us a little bit about why you're excited about this topic and how you got here, and then we'll talk about brain injury itself.
Sure. So I had a long career that I'll keep it as quick as possible. I went to the U.S. Military Academy at West Point out of high school and commissioned into the Army. Spent 5 years in the Army out in line units through airborne school, jumping out of airplanes, Ranger school, and other kinds of fun training like that. And then decided it's not what I wanted to continue to do. And so I had always wanted to be a doctor. I grew up in a family where my father was a doctor, my mother was a nurse. So I went off to medical school, courtesy of the Army. And
Right.
on the way to becoming a surgeon, kind of took a different turn and ended up getting trained in preventive medicine and public health and how to keep people healthy and out of hospitals, hopefully. And more specifically, got trained in international infectious disease work and epidemiology. So I spent a number of years in Asia looking as a disease hunter, setting up systems and looking for interesting things. I was there on ground floor, if you will, ground zero for SARS and bird flu and other fun things like that. Did massive outbreak investigations of different things. And then the Army said, got all this experience, come back and teach medical students at the military medical school in Bethesda. And by now, Iraq and Afghanistan were in full swing. And so, here I am in Bethesda, the Walter Reed National Medical Center, and there's wounded warriors everywhere. And I kind of the really short of the stories, I put two and two together and came up with an odd number. And I went to the head of research at the Defense Veteran Brain Injury Center and asked him, is anybody looking at the use of omega-3s like you would get from fish oil to help our soldiers recover from traumatic brain injury? And
Mm.
he thought about it for a second and he goes, no, why don't you? And because I don't know anything about it. And he kept, I kept making different excuses, but you're the only one asking the question.
That's right.
And he had some, I got some seed money. Why don't you start a research program on it? And so that was a total career change. That was 18 years ago. And I've been
Mm.
on that quest ever since. While I was still on active duty, and then eventually I had enough time to retire. So I retired as a colonel, and I continued on that quest now, gee, 13 years since I retired. I can't believe it. Time flies. And I continue to try to push the envelope on how can we use nutrition uh, as a therapy, if you will, for brain injury, not just traumatic brain injury, but I look at, the lack of brain health is a big problem, whether it's from substance abuse or whether it's from trauma or an acquired brain injury, such as a stroke.
Okay.
But, I'll just quickly summarize all that because you said you wanted to talk about brain injury. So, when there's different ways the brain can get injured, right? You can have trauma. You slip on the ice, you hit your head, the brain hits the inside of your skull, and you got essentially look at if there's not outright bleeding, there's at least some microscopic bruising and stretching and pulling of the connections between different parts of the brain. But you could have a stroke. You could have, say, a heart attack where your heart stops for a little bit and somebody does CPR and revives you, and then you've got an anoxic. You didn't have blood flow to the brain for a couple of minutes. So that could be an injury. You've got chemo brain from
This might
chemotherapy,
this might
and
be
you've
true
got,
for people. Well,
what's
so
that?
this might be true for people who've had overdoses and
Well,
have
that's
had
what I
to
was
be
gonna say.
revived.
You
Yeah.
have chemo brain, right, from
Right.
chemotherapy. But when you have somebody that overdoses, you probably may have a couple of different mechanisms going on all at the same time, right? You've got a chemical insult that could be damaging to the brain. You might have had a cardiac arrest from that, and so then you have the lack of oxygen. So it could be multiple ways and then they fell down and hit their head, so it could be
Sure.
multiple ways of having it. And so all these different mechanism of injury, whether it's from literally from aging and chronic stress to chemical insults to the brain to traumatic brain injuries, things like that, that's the injury. But then you have these biochemical cascades that continue on. Basically, think of it as chronic inflammation going on in the brain that if we don't resolve it, it's going to continue to, I'd say it's like a little brush fire that kind of burns and churns through the brain. And if you don't get the fire extinguisher out and douse those flames, it's going to continue to cause problems, potentially not just minutes, hours, days, but even potentially for years and decades later. I mean, I always point out the one example that's pretty obvious, right? Muhammad Ali took a few hits to
Mhm.
the head as a young man, and he died of Parkinson's, not when he was 25 or 30, but, much later in life. Was there a connection? I believe absolutely that there's a connection. But the underlying thing, what's the connection? Inflammation, in my opinion, is chronic inflammation that never got actively or adequately dealt with. Same thing with
Mhm.
when you're talking about, addiction, and your area where people have had chemical insults, whether it's from alcohol or from drugs. It sets off these biochemical cascades, the inflammation, and if
Mhm.
you don't right size that, then it's going to continue to cause problems down the line.
What sort of problems, what kind of symptoms are you going to see in people who've had these either acute brain insults or this kind of gradual inflammation caused brain injury?
Well, one of the things that's kind of an important aspect to consider is age. So young
Hmm.
people recover much better, much quicker
Good.
than somebody our age. And but also if you have injuries when you're a teenager or in your early 20s, what I often see, having spent a career in the military and I do a lot of work with veterans still, is that especially if they're really got their act together, they're doing well, but on the side they because of the brain injuries that have accumulated from, say, roadside bombs or playing football in high school or college, all these things add up. What I find often is they hold it together until you get into sort of your mid to late 40s or early 50s, almost about think about the menopause in women.
Hmm.
Well, men go through kind of similar changes, it's just not so overt. And I think that change in life around your late 40s, early 50s, where your hormones are starting to do different things. I think that just compounds things. And so you see people that held it together really well. And then I say the wheels start to come off the bus as they get up towards in their late 40s, early 50s, and they start to have struggles that they didn't have. So age compounds things as well.
Sure. And I suspect that some of what happens with people, because we know that most people do not feed themselves well, they do not make food choices that help brain health. They're eating a lot of ultra highly processed foods with not very much nutritional value in them. And we know that the brain actually needs specific nutrients to function, to repair itself, to modulate inflammation and to allow us to function optimally. So it would make sense to me that after a couple of decades, you have a couple of sort of insults to the brain along the way and people are managing, but then they're just not feeding their brains. They're not taking care of themselves. And now we have a cumulative effect.
Exactly, right. And that's probably the big key is it's a cumulative effect, but you also have to look at our environment. Our environment is a huge thing. You've got genetics, which of course plays a big part, but our environment. So the food that we eat today, that we're exposed to today, that we have access today is
Mhm.
very in many ways very different than 30, 40, 60 years ago.
Yeah,
And
very
and
different.
not in a good and not usually in a good way.
Mm.
And so, the one of my favorite quotes, I wish I could quote it, but I'll paraphrase it, is about how we're slowly starving our population to death from the micro lack of micronutrients in the
Uh,
soil. And that was from some Senate testimony in 1936.
36. Oh my goodness. And things
1936.
have
So you
just
can
gotten worse
imagine
since
how
then.
compounded that's become since then, right?
Sure. That's pretty powerful. So, what are some of the behaviors or cognitive struggles people are going to have? And how do you think this impacts their ability to um, do well in treatment and in recovery?
Well, I'll come at it from the clinical aspect of a concussion, but it goes much broader than that. So when I'm talking with somebody and I want to describe what a concussion is like, a concussion, what it feels like is that you have a really bad head cold without the runny nose. So, think of the last time you had a really bad head cold. You feel like your head's stuffed full of cotton. You can't think clearly. You just want to crawl back in bed and pull the covers over your head. You want to, you can't sleep enough. You're just exhausted all the time. But more importantly, you can't think fast. Your thought processes become slowed down and like trying to walk through chest high mud. type of thing. And so that's how I would describe it in world of concussion, but it also holds true for any of the things we're talking about. And so if your brain has got these insults um, drug abuse and alcohol abuse, it's essentially it's a brain injury. So it didn't matter whether it came from from a traumatic brain injury or a chemical insult to the brain. That those type of symptoms can be very much similar, and where you just your cognition is slowed down. You can't remember things like you used to, and you start
Mhm.
to forget words, or you forget where you put your keys, and things that when you were younger, you just boom boom boom, you just did 1 2 3, you didn't even think twice about it. Now all of a sudden you 1 2, well, what comes after that? And you just don't think as quickly or as clearly. And so whether it's from substance abuse, damage to the brain, or traumatic, it's all very, very, very similar.
Yes. Break. And I listened to a lecture last year at an addiction conference where they talked about specific ways in which people with brain injury struggled in treatment. That they had lower like brain endurance, more what's I guess called brain fatigue. They couldn't necessarily last through an entire lecture. They would get more tired or more distracted or get some headaches, that they had trouble remembering what they were learning and possibly even doing the writing homework. That some of the accommodations were actually to do the homework by speaking into a microphone rather than writing it down. And I know that for people outside of treatment, it can be hard with a brain injury to sometimes be able to, this is where it kind of overlaps with cognitive executive functioning and some ADHD symptoms, getting places on time, being able to engage like in a 12-step program or even a therapy session, because as you said, it can feel like you're slogging through mud or your brain is just, and so I think that this matters, plays out in so many different ways in addiction treatment.
Oh, absolutely. And, um, you know, your focus, which I think is absolutely spot on, is how can we use nutrition as in my opinion, as a very powerful weapon, if you will, to combat that. And um, so nutrition is everything. And I'm not sure when in the world that nutrition became alternative, but
Hmm.
but it seems like the Western medicine looks at nutrition as an alternative thing, when in fact it is the absolute foundation of lifestyle, as they call it, lifestyle medicine, which is really optimizing your diet and exercise, your nutritional status,
Their nutritional status. Well,
and so
we know exactly the nutrients that the brain needs to function and to repair itself. And some of these crucial nutrients are the right fats. And this is where I think the omega-3 fatty acids come in.
absolutely. I mean, the brain is made of fat. We can. There's a reason why we've got the jokes of calling somebody a fat head and things like that. It's because literally your brain is made of fat. And if we think about the different types of fat, in a way, three of the most important types of fats, we demonize some of it, right? Cholesterol is
Cholesterol.
probably the most prominent. Cholesterol is probably the most prominent fat, and it's absolutely 100% necessary for your brain,
Mm-hmm.
for every cell in your body, and all your hormones. If you look at your hormones, the chemical structure of your hormones, whether it's testosterone or estrogen, progesterone, or so on, thyroid, there, if you look at the chemical structure and compare it to the chemical structure of cholesterol, they look almost exactly the same because that's where it comes from. And so, cholesterol is a really hugely important one. I think that we've demonized in
Mm.
many ways, but also, what we call our omega fats, in particular, omega-6 type of fats and omega-3 type of fats. And in just really broad general terms, omega, you need both. You got to have both.
Right.
There's, a huge percentage of the brain is made of these types of fats. But omega-6s and omega-3s by nature were designed to be in balance because they share the same enzymes for processing, to make them and to break them down and things like that. And so why is that? Because omega-6s, the downstream effect of omega-6s are to promote inflammation and also to promote your blood to clot. Whereas the
Mm.
omega-3s are the opposite. They're to promote the resolution of inflammation. So they're anti-inflammatory, if you will, and also to keep your blood from clotting. And so if you think about it, it's just basic balance between blood clotting and not clotting, right? Too much clotting, you die of a heart attack, and not enough, you bleed to death. But it also holds true for inflammation. Inflammation is life. We need inflammation to recover from all the insults that we get every day, every minute of our life, the radiation from the sun, the radiation from the earth, are breathing, particularly if you live in a city, breathing city air. So we're always being bombarded by toxins and radiation, and our
Right.
body responds to it with inflammation, but we need to resolve the inflammation. And here's the problem. 200 years ago, those our intake and our bodies, if we were to go back and check the blood of people from 300 years ago,
Uh-huh.
pre-industrial revolution, our
Yeah.
omega-6 and our omega-3 blood levels would be roughly equal. They're meant to be
Right.
in balance. But through the industrial revolution, and then it's accelerated in the last 50 to 70 years post World War II, where our omega-6 levels have gone through the roof. So the average American is 25, 26 to 1 ratio of omega-6 to omega-3. So it's no longer a fair fight. So what we eat sets up our body for this pro-inflammatory milieu
Can
and
you talk
not
about
enough
those foods?
resolution.
Can you talk about those foods? The pro-inflammatory foods versus the anti-inflammatory foods, and what's
So
changed in the diet over the last 150 odd years?
So there's a couple of things. So omega-6 is the biggest, really the biggest source of omega-6s, the pro-inflammatory ones, fats, are vegetable oils, such as
Mhm.
soybean oil and vegetable oil and safflower, sunflower, pick your
Corn,
vegetable. Corn oil,
peanuts.
absolutely. So, and you say, well, I don't eat soy. Well, yeah, actually you do. You just don't know it because all the animal feed is based on soy and corn. And
Right.
so the percentage of, or the amount of omega-6s and how it's changed since World War II, the amount of soybean oil consumed across the United States on average has gone up 16, 18, maybe even higher, 20% over that time. 20 times
Hmm.
as much as it was, say, during, around World War II or pre-World War II. And you're like, well, yeah, but I don't eat soybean oil or I don't eat soy. Well, again, yeah, you do. You just don't know it. It's because it's so
Right.
shelf stable. It's what we use to process foods. So now we're processing foods with it, right? And
That's right.
that's where we get all this intake of omega-6s. It's not that we're eating a lot less omega-3s, although we pretty much are,
We are,
except
though.
we're consuming a lot more omega-6s. So where do omega-3s come from?
animal meat, really. I mean, leafy green
Well,
vegetables, dark green.
healthy,
What's that?
healthy animal meat, healthy
Healthy
animal
animal
meat,
meat,
the
right? So
grass fed, the wild game.
wild game, wild caught seafood. Our seafood is probably the best source of omega-3s naturally today. Not farm raised seafood, but wild caught seafood. But we
Mhm.
don't eat wild game like we used to. Unless you're a hunter and you eat deer meat and venison, you're not really getting a lot of wild game. And the
That's
reason
right.
why that's important is you say, well, I gave up red meat, and I only eat chicken. Well, that's great, and that might be healthy for you, but you're missing certain things by not eating red meat. But is it really healthier when the chicken is being fed nothing but soy and corn? So
Hmm.
I would argue
Other
no.
than
I
flax
mean, you're
seeds.
better off eating grass-fed beef than you are a typical broiler chicken that's raised in a coop with 10,000 other chickens and fed soy and corn. So
Mhm.
the quality of not just what you eat, but what the entire food chain gives you what you eat. So you have to look at the whole bigger picture.
That is so interesting. But then, of course, we have, the walnuts, we have your dark green leafies, we have one of my favorite weeds, which is purslane, which used to be a very widely eaten weed and plant, for salads and to thicken soups, and it grows all around the world. It's very high in the omega-3s as well as other nutrients, and most people have no idea what it is.
No, absolutely. Dandelion leaves, it's my mother tells stories. Well, I mean, she's passed, a number of years ago, but she used to tell stories about how it was a delicacy when she was growing up, is
Mhm.
dandelion leaves.
Yes. So we need them. Now,
Absolutely.
can you tell us about kind of your research with fish oil? And well, I'm going to start with the story, and then I'd like to hear from you some of the research you've seen, some of the stories you've seen, some of the doses you've used. But the story I want to share first is how I first got introduced to this whole concept of using fish oil and the omega-3 fatty acids for brain injury was somewhere around 2017 when your book, When Brains Collide, was published. And I read it and I was so excited by everything I was learning in your book. I wasn't quite sure how I was going to use the information, but it was exciting. And just about 2 weeks later, out of the blue, this woman calls me and asks if I could help her husband. Apparently, I came highly recommended, and she said that has been fully disabled for 30 years since an explosion in the Gulf War where he got a major concussion. He's been to every brain injury clinic through the VA in the country. Nobody's been able to help him. He, the injury is so severe that if he stood up for more than 2 minutes at a time, he would get these horrible, sharp shooting pains in his brain and fall down. And so he's not been able to be left alone for 30 years. Exactly. And she said, well, can you help us? And I'm thinking, I'm not a brain injury specialist. I don't know. And then I said to her, but I just read this book. And this doctor did all this research. And in the book, he says to use 15 grams of good quality fish oil like Nordic Naturals, 5 grams 3 times a day, with basically 5 little capsules 3 times a day with food for a week. And that so many symptoms will resolve in a week. I said, that's all I know, but it's not going to hurt. You want to try it? And she said, absolutely. So she started giving her husband this fish oil. And a week later, she calls me up and says, oh my goodness, he can now stand up for 10 minutes at a time without collapsing. Well, that was pretty significant, but certainly, not enough improvement. So we looked at each other and I said, well, let's do it for another week. And so we did it for another week. And week by week, at the end of 3 months, this man who'd been completely disabled for 30 years was up walking around his house, doing light chores for hours at a time, and he could finally be left alone for hours at a time without any worry at all.
Pretty amazing, isn't it?
Isn't that an amazing story?
Well, and the irony, of course, is the doctors are going to look at it and say, well, oh, there's no science to prove that it works. Oh, it's just this. It's just a placebo. It's on and on. And of course, you and I are looking at it saying that's the power of nutrition.
That's right. And we actually know why. We actually specifically know what the omega-3 molecules are doing in the brain and why it works. And this is what takes it out of the category of placebo, because we can point out the scientific mechanisms or the molecular mechanisms that make it work.
Well, and an interesting, I'd say I've had the opportunity, not many, but I've had the opportunity to deal with some neurologic diseases in dogs and animals.
Mm.
And, dogs, there's no placebo effect there, right? And, just had miraculous recovery type of stories with dogs and recovering neurologic function, and particularly German Shepherds. And I guess they get somewhere around 8, 10, 12 years of age, they have issues with their hind legs neurologically.
Right. I've
And
seen that.
and fish oil can literally turn that right around. And I've seen that a couple of times. It's pretty amazing. Like I said, there's you're not gonna get a placebo effect with an animal. So
What about Wernicke-Korsakoff syndrome?
I don't have any experience in that in particular, so I really can't speak to that. But wouldn't surprise me, and I always look at it as the only downside is what it costs you to buy the fish oil. I mean, there's really not a downside to it to try. And so I wouldn't be surprised, and I would have to dig into the literature a little bit. One of the things that I always look at is when I was trying to first learn about omega-3s and who knew what in the world about omega-3s in the brain, and there wasn't very many people, honestly.
Mhm.
One of the people I got to know was a psychiatrist at the National Institutes of Health. And more specifically, he ran a research in at the National Institutes of Alcohol and Alcohol Abuse.
Mhm.
And so he was really interested as a psychiatrist on the effect of nutrition, particularly omega-3s, in that alcohol and drug abuse world. And
Sure.
a huge amount of publications on his work. So one of the things he looked at was suicide. And as I was getting to know him, he one time said to me, if we could just draw blood on people before they commit suicide, we could answer some questions. And I like, well, that's easy. Why didn't you say that before? And he looked at me like I was crazy. And it's like the military has got 50 million specimens of blood sitting just in a freezer just down the road from here with all of the DoD data behind it. So we put together a study, 100 documented active duty military suicides over time, and we got really well documented, well matched controls. And what we figured out was it was a 62% increased risk of suicide with low DHA omega-3 levels. It was
Oh
more
my.
important than any of we had access to the DoD data behind it. So it was actually even more important than any of the psychiatric data. If they were diagnosed with PTSD or any kind of, if they're ever even seen in the mental health world, was only like a 51% or so risk of suicide, whereas this basic nutritional marker that we could change for pennies a day, a 62% increased risk of suicide.
That's pretty powerful.
Well, we thought so, but especially because you could literally change it for pennies a day.
Uh-huh. The military listened to this at all?
Of course not. I mean, I've been friends with a lot of the leadership in the military just by the guys I grew up with, right?
Hmm.
Two of
Hmm.
my roommates when I was a junior officer have become, and now just recently retired, four-star generals on the Joint Chiefs of Staff, the Chief of Staff of the Army and the Chief of the Guard and National and Reserve. And
Hmm.
they all take fish oil because I convinced them that it's important and they all took it for themselves. But institutionalizing that has been a
Hmm.
major, major problem, mainly because of the doctors in the military are the ones that throw the roadblocks in the way. And they're
That's
like,
right.
well, there's no double-blinded placebo-controlled clinical trials to prove that it works. But we're not willing to do it. We're not willing to do the science to, because I'm not sure why. I think the biggest thing is that nobody's going to make any money off of it. Honestly, that's what I think.
Sure.
And because it's got the generic problem, if you will, right? So no drug company is
That's
ever going
right.
to spend the tens of millions of dollars to do the studies because you can go to CVS or Walgreens or your local pharmacy and buy fish oil or Costco or
Mhm.
what
Mhm.
Sam's Club. You can buy, fish oil all day long. And, so nobody's going to make any money off of it. So nobody wants to do the research to prove I try to do it the opposite way. I'm like, do the research to prove me wrong.
That's right.
And and you still don't get anywhere with that.
I've heard concerns from doctors that you can get too much fish oil, and that if you get too much fish oil, maybe you'll get a bleeding disorder and maybe you'll have a heart condition. So can you both speak to that, but also how do we test as to whether or not we have too much versus not enough?
Great questions. In fact, when I published the suicide study in a major medical journal, I got called to the Pentagon to brief one of the four stars, and what I proposed, I didn't want to go to him with a problem. I wanted to go to him with a solution because problem everybody got problems, right? So, and I told him, I said, we can't require soldiers to take fish oil. And he goes, why not? And I was like, well, because, 19-year-old's going to complain to his mother, who's going to complain to the congressman, and you're going to be answering to the congressman. It's just not going to work. I said, but what we can do is test people.
Hmm.
And that was the program I tried to pitch to him I wasn't, and of course the doctor said we can't do any of that because there's no proof that it works. Well, I wasn't even proposing that we make people take fish oil. I was
Right.
proposing we just test people to see what their levels are. So you can do it's typically done a blood spot test where
Yeah.
you prick your finger and you put it on filter paper and you send it into the lab and um, you know,
Hmm.
there's a really good Norwegian company now that is just kind of getting into the US where you can do it at home. You don't need a doctor's order. You literally do it at home and mail it in, and you get an email with, anonymized, but you go into your email and you can check the results. And so, there's great systems out there to be able to test what your levels are. The two
But,
most
but
important.
even even the big labs, right? By LabCorp and Quest,
Well,
which
you
a
can
lot
do
of
a
treatment
fatty
programs
acid.
are going to use, they
Well, you
do
can,
it.
right, you can do a fatty acid panel, but you got to know how to interpret it. And
Ah.
And that's the thing is there's really the two most important numbers would be your omega-6 to omega-3 ratio,
Hmm.
and that should be 3 to 1 or better. Ideally, it should be 1 to 1.
Hmm.
So omega-6 to omega-3, 3 to 1 or better. And your what's called your omega-3 index, which should be 8% or better. So I'm kind of
Okay.
doing ratios and percentages here. They're not absolute numbers because it's all
Sure.
relative. So that's a really
Sure.
important thing that a lot of doctors don't quite grasp because they want a number. What's the range? Things like that. And so it's a ratio and a percentage because that's those are the important numbers. Um, you had a second part to that question. So you can test it, and that's a simple way to test it. I just blanked on the first part that you asked.
Some doctors are sort of scared. I mean, when
Ah,
I told my doctor that I was taking 2 grams of the omega-3s a day, and it turns out that for my body weight, that's actually not enough. But he said, "Oh, that's the top of what you should be taking."
right.
That
So
could get
too much.
dangerous.
Can you take too much omega-3s? Too many?
Too many.
Answer is theoretically, yes, but you would have to take so much you would get tired of taking it. I mean, you wouldn't be able to afford it very long because you would have to take so much. We're talking about, you mentioned 10 grams a day. That's not even very much, honestly. That's probably
Hmm.
just enough to get things, that's just enough to get things kind of rolling. Um, but can you theoretically take too much? So what would happen if you did? Number one is, it's anti-inflammatory. So you could go too far on the decreasing inflammation where you can suppress your immune system. That's theoretically possible. But omega-6s are so ubiquitous um, throughout our food supply that it's really never going to be an issue.
Hmm.
Can you bleed? Well, theoretically, once again, yes, you could, but you would have to take so much fish oil to reach a level where bleeding would become an issue. And so I've challenged pretty much all of the leading researchers in the omega-3 world, not that many, but challenge them all to show me a single study in the literature where bleeding was an issue. And not a single one has ever been able to do it because it doesn't exist.
Well,
And
I even I even heard of a surgeon who's requiring his patients to supplement with the omega-3s before and after surgery to prevent postoperative inflammation and to speed up the healing. And I found this really interesting. I couldn't tell you who the surgeon was, um, but because I've
I could.
heard that, oh, you know who he is?
So Bob Martindale's a retired Army colonel. He was at medical college at Georgia, and then went out to West. He's at Oregon Health Sciences University, and
Uh-huh.
he runs the general surgery program, and he requires his patients to be on omega-3s for a week prior to surgery whenever possible. And MD, PhD in nutrition, and he was given a
Yeah.
podcast once. This was probably about 10 years ago, and basically somebody asked a question. He goes, "We've got to put this old wives' tale to rest. It's just a myth." Um, and then more recently, there's actually a few studies or a few reviews. I could point to one in specific. I couldn't tell you the name. I'd have to look it up on my computer, but where literally it dispels all the myths and rumors about bleeding. In fact, that it's not an issue. There's a number of years ago now, there's a study where in Italy where they were doing cardiac bypass surgery, coronary artery bypass surgery, kind of a bloody surgery, and they did a placebo-controlled trial looking at omega-3s versus not omega-3s, and you're absolutely right. Bleeding was not an issue, number one, but more importantly, the length of stay, the length of the ICU time, the length of discharge from the ICU and from the hospital, and the use of antibiotics, the use of pain medicine, all these different factors were improved with omega-3s versus placebo. And that was at least got to be 15 years ago when they did that study. So there's a recent review, like I said, that basically says we just got to stop talking about this because it's not an issue. Bleeding does not happen. And then I get the things of, well, I'm on blood thinners because of X, Y, or Z, and my doctor says that I can't take fish oil because it might harm me. And
That's
I'm
right.
like, your blood couldn't clot if it paid it to clot because you're on these pharmaceutical blood thinners that do nothing for your brain. All it literally does is keep your blood from clotting. You can't make that worse. And yet your doctor's telling you, fish oil, you can't take fish oil because you might bleed to death. Well, maybe you should stop taking the blood thinners. And or if you're going to do it a little more scientifically, adjust the blood thinners to deal with any potential issues that you have with the omega-3s, because the omega-3s are actually going to help you. The blood thinners aren't going to do anything for you other than keeping your blood from clotting.
No, and you can actually test for clotting time.
Oh,
So you can
absolutely.
do it
Well, I mean,
absolutely
anybody on blood
safely.
thinners has that tested on a regular basis.
Yeah, yeah. So it's really a moot point.
Well, it is,
So,
but that's not how the medical world, how physicians treat it. They treat it
no,
as the nutrition is the bad guy and not the pharmaceuticals, because that's what they were taught, and it's wrong, and it's these crazy old wives' tales that need to be put to rest.
that's right. And it's dangerous. It's harming people. It's harming people. And as
Well,
far as
it's
I'm
you're
concerned, too
you're
many
either
people have
harming
died
people
anyway.
or you're not allowing the opportunity to help people because of
Hmm. That's right. That's right. So decades ago, I was 30 and I was pretty ill. I had depression and anxiety and pain and chronic fatigue syndrome before that term was, ever created. And my doctor said, called me up one day and said, I've been reading about these omega-3 fatty acids, about fish oil, and I think you should take some. So it was like, okay. I said, what should I take? She said, well, cod liver oil. Well, I didn't have very much money in those days, and cod liver oil or fish oil capsules were kind of pricey to my budget, but cod liver oil liquid was very inexpensive. So I started taking a tablespoon of cod liver oil every day. Now, a tablespoon of cod liver oil is sort of nasty. It tastes nasty. You're swallowing a tablespoon of oil. It's like, ooh. But within 3 to 4 days of taking this fish oil, it's like the sun came out. I had brighter cognition. I had brighter mood. I had brighter energy. It didn't fix me, but it just made everything so much better and more tolerable. And I felt much more alive on the cod liver oil than I had before. So after a year, I was making a little more money and I switched over to capsules and I've stayed, until very recently in the capsules because they taste so much better. But will never ever forget how it felt with that sun rising after 3 days on the cod liver oil.
cod liver oil is pretty amazing. It's the least processed of the fish oils, if you will, that you can buy
Hmm.
commercially. And because of that, it's more of you get more of the entourage effect, the whole food type of effect. So
Hmm.
cod liver oil tends to be, higher in vitamin A and most importantly, vitamin D. And
Right.
plus, all the extra little proteins and nutrients that you get. It's like literally squeezing a fish type of thing. Whereas, the there's some great products out there on the market, but they're highly processed, and but this is in a good way, somewhat, in that you want to clean the fish oil from the toxins, the mercuries, and things like that. But in the process, when you do that type of cleaning, while you concentrate on the EPA and the DHA, the omega-3s, um, you do it so at the expense of what's called the polyphenols, the sort of the cofactors that really help the omega-3s get through the digestive system and into the brain and do their work. They're really partners with the omega-3s that we have taken for granted when we process the food, the fish oil to make a, because you don't obviously want the mercury and all the heavy metals and things like that. But we lose something with that. And with cod liver oil, you get a little bit more of a whole food, but you really can't take the higher doses. Like, I talk about, the patient was taking,
Yeah,
5 grams 3 times a day. You wouldn't want to do that with cod liver oil just because you'd be getting too much of the vitamin A and vitamin
that's right.
D and such. But on a daily basis, cod liver oil is fantastic, honestly.
Yeah, well, it certainly did well by me, but the positive effects have continued, even using different types of fish oil. So we need to bring this to a close in a moment, but do you have any favorite client stories that you could share with us?
Well, probably the one that I'm known for the most, because we published it as a case report, and it was really the one that accelerated everything, if you will.
Hmm.
Um, and if you get my book, When Brains Collide, I start and end the book about this with this story. And I call it the story of Bobby. And I'm still in touch with Bobby. In fact, multiple emails over the last couple days with him. But
Ah,
back in 2010, so I started on this trek. I first asked that question, is anybody using omega-3s in December of 2006.
hmm.
And March of 2010, I'm starting to get to be known for my work in this field. And I'm in Washington D.C., so the Defense Brain Injury Center wanted me to go down and meet with congressmen on Brain Injury Awareness Day. So I'm literally down at the U.S. Capitol on the steps of the U.S. Capitol, overlooking the mall and the Washington Monument and everything. And my phone rings, and phone in my pocket. I open up my phone, and it is, hey Mike, this is Jerry with at the FDA, and I was like, oh, I'm in trouble now. The FDA's on to me, and he goes, no, this is personal. A friend of mine, their 18-year-old son was in a bad car accident in Northern Virginia, and he's in a coma. They don't think he's going to survive. What do you think about using fish oil like they did for the Sago mine accident in West Virginia? And back it was January 2006, and I was like, well, nobody's ever tried it for traumatic brain injury. There's nothing in the literature about it. I said, but they got nothing to lose. I said, if the father calls me, I'll give him some guidance. And so 2 seconds later, the father calls me, and I said, "Well, go to Whole Foods. There's one right by the hospital, and get a liquid fish oil." And he goes, what do I get? And I'm like, I don't know. Nordic Naturals is a good brand. Why don't you get Nordic Naturals? And so he got Nordic Naturals, and how much? I'm like, I don't know.
Yeah.
How about a tablespoon, 15 mLs, a tablespoon twice a day? That, 30 grams of fish oil. I think, if there's anything's going to help, that should. Well, the next day, the neurosurgeon called me, and I was over at the NIH with my colleague, and wanting me to do. And I said, well, what's the situation? He goes, he's not going to survive. We should just pull the plug. But the parents refused. And I'm like, Well, then you got nothing to lose. Why don't you just
Right.
try it and see what happens? So the neurosurgeon, to her credit, said, "Okay, we'll give it a try." I don't think it's going to work, and I think that they just need to let the kid go. Um, 3 months later, he went to his high school graduation. So clearly something happened, and he continued on. He was home shortly thereafter, and that was 2010. And like I said, I just got probably 10 emails and texts from Bobby in the last 2 weeks,
Oh,
asking for things, updated. He went on to get his degree from college. He's working a couple different jobs, living on his own, which is a big deal for him. And he's like a stroke survivor, where his brain damage, he got some weakness, but he obviously is living as good a life as possible,
mhm.
but completely unexpected. We published that as a case report in the literature, and it's still really the only case report of just a pure traumatic brain injury in the use of omega-3s. And it's had its ripple effect on other things that have shown up in the literature as well. But that's sort of my big story that I like to point out, and that Bobby to this day continues to do well and always seeking what can I do better. So
Ah, what an amazing story. That's it's one of those stories that almost brings tears to your eyes.
yeah, Bobby's pretty special.
Yeah,
So
yeah. And I suspect you have other stories like that too. Well, I've invited you to speak at the upcoming conference on nutrition and addiction treatment and recovery in Columbus, Ohio in May. It's also going to be online and recorded. So I'm really looking forward to having you talk more about this and to meet you in person, and to have so many people in my community are really looking forward to meeting you. Until we get there, what are some good ways for people to contact you?
well, when I retired from the military, I started a small nonprofit called Brain Health Education and Research Institute. And,
Mhm.
and it really, for the most part, has been emphasizing more the education part. But brainhealtheducation.org is the website for that. But
Okay.
recently, we've pivoted a little bit, not just doing education, but doing actual recommendation, and treatment for veterans. But we hope to expand that as well, beyond veterans. And so Barry.org, Brain Health Education. So BHERI.org is kind of our therapy side of things, whereas the brainhealtheducation.org is more the educational side of things.
Okay.
And so that's the best way to reach out to me.
Okay. And I have one final question. If you were to make a recommendation to a treatment program, if they were going to use nutraceuticals on a daily basis with their patient population, what would be your recommendation as to a daily omega-3 dose?
Well, number one, and you kind of alluded to this, and that I was taking 2 grams, and that may not even be enough for my size, my body type. So testing is probably the best way to go. So
Okay.
home-based testing is really, I think undervalued. And so you can adjust the dose for that. So 2 capsules for this person for a tiny 100-pound woman is not the same as 2 capsules for a 250-pound man, right? But yet that's what it says in the bottle. Take two.
Sure.
So I think adjusting it for body weight is really important. And if we're looking for specific recommendations, what I ended up figuring out and kind of basing everything on was actually, um, you want me to get into it? It may be a little complicated, but
Let's see, in 30 seconds.
I would say that you got to look at the amount of EPA and DHA, the total milligrams of EPA and DHA, 40 milligrams per kilogram. And you can figure out the math behind that and put it into pounds and this, that, and the other. But
Okay.
that's
Okay.
the dose that I base things on
I
a
will
daily
let
basis.
the medical director contact you directly for that type of specificity.
Yeah, that would probably be the best.
But anyway, we know minimum 2 grams a day will be very helpful.
Right.
Michael, thank you so much for joining us. This was a delightful conversation, and I certainly learned a lot about the importance of supporting brain function and decreasing inflammation using the omega-3 fatty acids. I look forward to seeing you in May.
I look forward to it as well.
Bye-bye. Welcome to Power Up Recovery with Nutrition. It is time to make nutrition part of the conversation. I'm your host, Christina Veselak, and I'm so glad you're here. Did you know that it's our brain's job to allow us to cope with stress gracefully? But to do that, it needs to be fed optimally. Have you ever wondered why so many committed people relapse or maybe even die? Why so many people on psychotropic medication still feel lousy and still have cravings? What if the missing piece is food, the right food? What if the right nutrients like amino acids or even eating protein every 4 hours could actually balance your brain chemistry and your mood without medication and support lasting recovery? In this podcast, we explore the powerful connection between feeding your brain well, mental health, relapse, and recovery from addiction. We will share insights from experts, inspiring recovery stories, and practical strategies you can use today. Whether you're in recovery, a healthcare professional, or someone passionate about emotional well being, this show is for you. Let's dive in and discover how fueling your body and brain with the right food, the right amino acids, and other key nutrients can fuel your transformation today. Welcome.